Perfect. Yeah. Thank you, Tim. Yeah. Welcome all to the 2022 Super Analytics Challenge. We're very excited to be able to kick off this challenge today. I think we have a terrific challenge ahead and really excited to get started with this challenge. So I wanted to review the schedule of what you can expect out of today. So I'm going to spend a couple minutes talking about the flow of the challenge, what's going to happen in the next couple of weeks. I'm going to then turn it over to Andy Hanna, who's going to address the challenge case and what he's seen from the advisory committee and the partnership with Lisa Scales. And Lisa Scales is here with us. She is the CEO and president of the Pittsburgh Foodbank. And she's going to give all of you a briefing about her operations, the service area of the Greater Pittsburgh Foodbank, and really the mission of the food bank, and then drill in a little bit more on her team's operations. We'll reserve some time for Q&A with her. So about 11:45, I will then hand it over to Monasir. Monasir is going to introduce the case. We've already posted that on Canvas for all of you. And then he's going to talk about some of the data sources that we've brought into this. We will then hear from Sandra Douglas, and Sandra is going to review just briefly some of the service volunteer opportunities that we've become aware of in case you want to go out and as part of the challenge, actually get closer to the subject matter and volunteer your time. And then Katie Bennett will actually give us a quick briefing on social media and what we'll be doing to bring attention to this cause, but also bring attention to the Pittsburgh Foodbank and their operations and how others can duly get involved in this important topic of food security and hunger. At 12 o'clock, we will then have an opportunity for our students to do a breakout with their executive coaches. I see a couple of our coaches on the phone here. Andy, welcome. Sandeep, welcome. Not all of our coaches are going to be available today, but those who are available, we'll give you an opportunity to break out and meet your coaches face to face. 1 o'clock, we will then have a briefing with Feeding America. And thanks to Lisa for making that connection. And they're going to brief us on the operations of that national umbrella organization, Feeding America, and what they do with the analytics from the national umbrella organization. And then 1:30, we'll have a guest speaker, a member of an advisory committee, Albert Powell, Managing Director for Data and Applied Intelligence in the Pittsburgh office, Managing Director for Word Accenture, who's going to talk about storytelling and provide some guidance on storytelling. So thank you all for being here. I will say what you can expect over the next week. This kickoff is really your opportunity to discover sort of the topic of food security and hunger. We have a lot of resources that we've put out. This will be a 2-week discovery period. You're able to connect with your executive coaches. Then in 2 weeks from now, we'll come back at the same time for the first judging phase, which will be concerning how you frame your problem. And then on Wednesday, February 16th, the second judging panel will discuss solution design and modeling. And then in 3 weeks from now, February 18th, you'll have your concluding solution presentations, and we'll have an award ceremony at that time. And members of our advisory committee are all part of the judging process as well. I will be sending out detailed instructions about the judging phases to all of you via Canvas sometime next week. I did want to also call out next Friday, we will have our experts in for a session on Ask the Experts. So from 11 to noon, we'll have our methods experts. Those are people who are steeped in sort of data science, data modeling. And then at 1 p.m. to 2 p.m., we'll have our subject matter experts come in, and these are individuals that are steeped in the area of food security and hunger, and also applying some analytics to that particular topic. The experts will post videos to YouTube on February 2nd. You'll have an opportunity to review their briefings, which will be like 15, 20 minutes long. And then during the Ask the Expert period, we'll have them come in, introduce themselves, their specialties, and then you'll have an opportunity to directly ask them questions. I can't stress enough how important it is to attend these sessions and take advantage of getting to know these experts. I see Montesir nodding his head because he knows he's been a part of this before. And we really lined up an outstanding panel of methods experts and subject matter experts for all of you to tap into. So people like Pamela Peel, who's a former chief analytics officer for UPMC, or Kelly Shields, who's a data scientist at Highmark, or we'll have Lauren Lipinski back from Feeding America. We'll have Pastor Aaron of the Hot Metal Bridge Community Faith Organization, and they are a partner to the Pittsburgh Foodbank, so they're a food pantry. So you'll have the national organization, and then you'll have a local partner to the food bank. And then additionally, we'll have Giant Eagle come in and talk about the supply side of being a partner to the food bank. And we'll also have an expert from Esri, their leading expert on analyzing through mapping food deserts. So really, can't stress how much this is going to be a great panel. Do attend. We do ask that at least one member from each team attend either the morning session or the afternoon session. So with your teams, we ask that you have one member from each team. At this point, we will be introducing, again, yesterday I sent an email to introduce you to your executive coaches. We'll have a breakout at the end, and these are the teams and the assignments. So at this point, I'd like to hand it over to Andy for a couple comments. Andy?
Sure. Thank you, Chris. And to all the students, thank you for being involved with this challenge. This is our second challenge, and we really, with these challenges, want to focus on something that's incredibly important to our community and globally. And I applaud you all for wanting to put your time and effort into this. We're very excited about it. Food insecurity. There's probably many of you on the phone who've experienced food insecurity at one time. Certainly, we've all been hungry at some point in time. That pales in comparison to the issues that people have, but we know how difficult it is to perform at our top or to even be active when we're hungry. So we want to, this is a critical issue that want to help try and solve. And you all have superpowers, right? Everybody on this phone has something that makes them unique and special, and something that enables them to do things that other people can't. And we have to remember that we need to use those superpowers for good, as well as for whatever our occupation is. And this is just a wonderful opportunity to do that. I really love the case. Montesir and his team did an incredible job putting that together. The data that's available for you to analyze against the problems that we're trying to solve is amazing. It also leaves room for you to be creative. Both the case and the data sources create the opportunity for you to go out and find more, to think differently about the questions that we want to solve, but also to think differently about what data might help us solve those problems. And what an incredible partner. Lisa and her team are really, it's just such a joy to work with you, Lisa, and your team. And we you need a good partner in order for these opportunities to come to a fruitful end. And it's not easy. The amount of time and effort that's been put into this by our team at Pitt, the administration, by Lisa and her team, and by our advisory committee. And you can see the list of names here and the positions that they hold. And, you're in a situation where these are just names on a page. I can tell you that every single one of these individuals has put their shoulder into this case and into the experience that you're going to have. So again, I'm incredibly excited. It's just I can't wait to watch what you all do through this process. So thank you, and yeah, let's get those engines started. At this point, I'd like to turn it over to Lisa to continue with the introductory comments and discussions around the case.
Well, thank you so much, Andy. I really appreciate that. And good morning, everyone. It's fabulous to be with all of you this morning. And want you all to know that all of us at the Food Bank are very excited. We're grateful for this opportunity to work with each and every one of you. And we look forward to seeing what you, as you progress through the challenge, to see what solutions you come up with. So I'm going to take us through this slide deck, probably about 20 minutes, because I want to leave about 10 or 15 minutes for questions. So I'm going to go through this presentation rather quickly, but want to really get you really steeped in food banking. It's something that I've devoted 25 years of my career to the food bank, and it's really been such a joy, this journey. So with that, I want to take you back to the very beginning of food banking. Chris, and thank you for advancing slides for me. So we do have a father of food banking. So this really shows how it's one person's vision. John Van Hengel in Phoenix, Arizona, back in the mid to late 60s, he saw food waste, but he also saw the need in the community. So he had this idea of collecting that food before it would go to a landfill, and then getting it out through organizations in the community. And so food banking started. He received a $50,000 federal grant, and there were 18 food banks across America. And that's how this amazing network was formed. And there are now 200 food banks across the country. So no matter where you are in the United States, there's a Feeding America food bank that serves your community. Next slide. So when we look about food banks, so food banks traditionally are warehouses that collect grocery items. Anything you'd see at a grocery store could come to a food bank, including, greeting cards. One time we had a tractor trailer load of greeting cards, believe it or not, but it's mostly food, but there are anything, laundry detergent, soap, toothpaste, those items as well. So we collect those, and then traditionally food banks have gotten it out, not directly to individuals, but through a network of food pantries that typically would provide, and today provide, about a 5-day supply of grocery items, typically towards the end of the month when people's food stamps, or what's now SNAP, when that runs out. So it's meant to be emergency food assistance. However, over time, many families rely on food assistance on an ongoing basis. But as you can see from this slide, we have partnerships. So you think about, it's the food supply, it's what's the food and grocery items, what's available, and then how do we get it out? So when you think about the supply chain, and of course, one of the biggest challenges we have as a food bank is that last mile, right? Is getting that closer to where people are when they need it. And that's, I'm really excited to talk about that in a little bit, but we bring the food in. Traditionally, we got it out through our network of food pantries, and then they provide it to individuals. Next slide. So I wanted to provide an overview, really the next slide showing our mission and or what the initial need in the community. So when our food bank was established in 1980, that was shortly after the collapse of the steel industry. So we had a high level of unemployment. There were also people in the community who are homeless. And so the food pantries that were set up, they were set up to be open once a month, usually the third or fourth week, for about 2 hours in the middle of the day, say the third Thursday of the month from 10 to noon, because again, we were serving mainly people who were not working, and a lot of core grocery items. So we had a dry warehouse, and it was all those core grocery items, very little, really no frozen, very little fresh food at the time. Next slide. And so the mission of the food bank is to feed people in need and mobilize our community to eliminate hunger. And our vision is a hunger-free Southwestern Pennsylvania. So how we work is we work in 11 counties in Southwestern Pennsylvania. Feeding America has assigned us this service area. So we're charged with the equitable distribution of food throughout our 11 county service area. And today we have 850 partners We have in 5 of the counties, the more rural counties, we have a smaller food bank, what we call a PDO or a partner distribution organization, and we contract with them to serve that county. They get their food from us, but the food goes out, and this past year we distributed enough food for 45 million meals, and on average we serve about 110,000 people per month. And about half of those people are children and seniors. So when you think about the most vulnerable neighbors, that's who we're serving. Next slide. So we have a defining moment. I want to kind of fast forward from 1980 when we opened our doors to 2015. Next slide, Chris. So if we look at that, we had a defining moment back at a board retreat in 2015. And that was shortly after Feeding America established what the meal gap was in across the country. And Lauren from Feeding America will talk more about that. But there was a calculation on what the meal gap is, and it actually goes down to the county level. And at the time, we were feeling good about our impact in the community. We were providing food for 29 million meals. However, what we learned from Feeding America, doing that analysis, is the meal gap. Those are the meals that people aren't able to provide for themselves or through other means, that our food bank was really responsible for providing a total of 48 million meals. And so that was a huge gap. And it was at that moment our board of directors were just stunned, and nobody said anything for several minutes. And then finally someone said, because we were saying, well, who can do this? Who can fill in this gap, this huge gap? We're already working really hard, and we're at the 29 million meals. And someone said, if not us, who? And then just the electricity in the room, there was, we just started to brainstorm. We just started to talk about how we could lift our organization to almost double what we were doing at the time. And so we established a bold goal. We set it for 2025, looking out over a 10-year horizon, to not only lead the community to close the meal gap, but also help the people we serve to stabilize their lives. So if you think about what the food bank does on a continuum, at one end of the continuum, we're meeting people's immediate food needs, right? We're getting out food and other grocery items. But the other end of the continuum is truly ending hunger. What can we do to reduce the need so we can shorten the line at our food pantries? And that's been the challenge for us over for the last 7 years. And so we're still on that path by 2025 to achieve these goals. Next slide. So we look at, and here's the meal gap. Here's where we've been. So we had 2015, and then 2016, we increased up to over 31 million meals. And you can see that we're on the path. We're on a good trend here over the past 7 years. Next slide. And so when we look at our 11 county service area, and you'll see Westmoreland is grayed out, they are a 1-county food bank. According to Feeding America, their service area is just Westmoreland County. We used to have them in our network as part of our network, but they felt they were large enough that they could be their own full member of Feeding America. But we are charged. We go up to Lawrence, as you can see, out to Cambria, Somerset, all around in southwestern Pennsylvania. And you can see when you look pre-pandemic to when the pandemic hit, that food insecurity rate increased by 31%. And it hit children especially hard. And we saw an uptick in that rate by 41%. But you can see the food insecurity rates here by county. And traditionally, Fayette does have the highest rates of food insecurity here. And this is a slightly outdated. I don't have the 2021 chart in here, but when you think about poverty and the poverty guidelines, so if you're a family of 4 and you're earning the income for that family is about $39,000, you are believed to be below the poverty line. So for our services, we serve, that's 150% of the poverty line, because we look at providing services to people who are low income or at or below 150% of the poverty line. Next slide. So often asked where our food comes from. Most people think of the food bank in terms of food donations, and certainly donations make up a large portion of the food that we distribute. You can see that that's 42%. A lot of that is fresh produce. I'll show that on another slide. The other buckets I put our food in addition to donated food, is purchase. We'll purchase items that aren't normally donated, such as eggs and sometimes meat and other core grocery items, and those essential personal care items. And then the government commodities. The biggest way the USDA, the federal government, supports food banks is actually providing food to us. Next slide. And then we have a lot, we're a food poor area. We don't have a lot of distribution centers here in southwestern Pennsylvania. We don't have a lot of food manufacturing anymore, as that's moved off to other places. But we do pick up, we have a food rescue program we have since 1988, and we pick up at local retail stores. We also, there's a little bit of a few distribution centers here and there. And then of course, nationally, we will get from USDA and also from growers. When we look at the amount of produce we're able to secure, a lot of that comes from food brokers and growers across the country. Next slide. So I mentioned produce. Produce is really our focus, as and you can see it's 32% of all the pounds. 12 million pounds is fresh produce. Our goal is by 2025. I'm not sure we're going to hit it, but our goal is that 50% of our distribution will be fresh produce, or 20 million pounds a year. We've increased it quite a bit over the last 6 or 7 years, but it is nutritious, and it's also expensive at the grocery store and not available in communities that are called food deserts. But this has really been brought about by a change in how food companies and grocery stores handle their product. There used to be, in food manufacturing, there used to be a number of overruns, mislabelings. All of those items would get donated to food banks, and they've gotten really good, and they should, is that businesses, those food manufacturers, they've really tightened it up, and look at Six Sigma and really skinning down their processes. So they have very little amount of waste that would have then gone to food banks. Good for them, for their businesses, but bad for the food bank. One example, Kraft macaroni and cheese. They used to make trailer loads, pallets and pallets of that, and it would be sitting in distribution centers around the country. And if they changed their label or got too close to the use by date, all of that product would be donated to food banks across the country. Nowadays, they don't even make the product until there's an order for it. So again, we really had seen, really starting in the early 2000s, a drop in those core grocery items being donated. So we've really been focusing on produce. Farming's not scientific yet, and so there's a lot of opportunity for food banks to receive donated produce. Next slide. So our partner network, when we think about our traditional food assistance partners, many of them are food pantries, as I mentioned before. We also have what we call an on-site. That's an agency that serves a prepared meal, such as a soup kitchen, a shelter, or Meals on Wheels. We also have a number of youth programs, and we do have our partners in 5 of the counties, a smaller food bank that helps kind of a spoke and wheel that they get out food to their counties. Next slide. We also have an on-site, a very small kind of emergency food we call Compassion Corner, and that's individuals who come in unannounced, and they come in and need immediate food assistance. And at that time, we also refer them to other resources. Next slide. We have their federal, a number of federal food assistance programs. Some of the ones that are more well known is that there's a program that provides nutritious food to income eligible senior citizens. We pack about 6,000 boxes through that program that goes out to our network partners every month. Next slide. And then in terms of children, there's a number of child nutrition programs, and one of the ones that's been underutilized is the summer food service program, eligible for any child regardless of income. And we've worked hard over the years to add sites throughout our service area, especially in those rural communities. But kids then have access to a nutritious meal when they're out of school in the summer, and they're missing those school breakfast, school lunch, those essential school meals. Next slide. There's also an after-school program. The federal government provides resources and provides reimbursement for meals and snacks in after-school programs. So we work with our programs, our partners that are operating after-school programs to get that reimbursement from the federal government. Next slide. We have a very large emphasis on health and wellness. As you can imagine, we serve a vulnerable population, kids, seniors, people with disabilities. And it's so important for us as what we believe we're a public health organization, for us to provide the most nutritious food. So I just want to take you through some of the aspects of that. Next slide. So when we think about someone who's food insecure and the impact it has on them, if you have poor dietary intake and you don't manage some of those diet-related diseases well, how that impacts you in terms of your health and wellness. And so we know if we can provide, people have consistent access to nutritious food, it will go a long way towards improving their ability to manage a disease such as diabetes, but will also result in better health. Next slide. So we look at what people do. If you're food insecure, you might be skipping meals, you're eating less nutritious food, it's food that's more filling, but it's going to cause higher rates of obesity, diabetes, hypertension. It really has a significant impact on your health. Next slide. So we look at, and you can see these numbers, they're quite high. The number of people who utilize our services throughout our network, 42% of the households have someone who's diabetic, 68% with high blood pressure, and 62% of the people, the last time we conducted a survey, said they had to choose between paying for food and paying for medicine or medical care. So it's food insecurity has an incredible impact on people's health and wellness. Next slide. So we look at we take diabetes as an example, and you have food security there at the top. And traditionally, the intervention is once somebody is diagnosed as being diabetic and they're challenged, they're not controlling it well. But if we can, in terms of the work we do, if we can intervene sooner and ensure people have consistent access to nutritious food, it may not get to the point where there's poor diabetes control. We may be able to work with other healthcare, with our healthcare providers to ensure that people are managing their diabetes better. Next slide. So we do have a wellness policy. So in the old days of food banking, we would accept everything that came in the door, but now really taking a look at what it is that we're offering people and really focused again on health and wellness. If we do not accept food that sugar is listed as the first ingredient, when we, for our purchase program, one of the 3 categories of food that we get, we focus on the food that's most nutritious. Next slide. And we have great, wonderful partnerships with healthcare providers, both with UPMC and Allegheny Health Network. We have our Thrive boxes, our nutritious food boxes at doctors' offices and hospitals. We also have AHN just opened their 5th on-site food pantry at Forbes Hospital. So they have 5 hospital pantries in their network. UPMC, we work with their community paramedic program. We actually have our Thrive boxes on the paramedic trucks. So we have great partnerships with our healthcare providers. Next slide. We really do focus on nutrition education, knowing that us getting the food out the door, if people don't eat it, then it's not right. It's only nutritious if you eat it. So we have cooking demonstrations. We support wellness at pantries. We provide recipe cards, and we do have a monthly nutrition newsletter. Next slide. So some of those, we started our cooking demos in the late 90s when we had a tractor trailer load of frozen salmon steaks, knowing that many of the people we serve may not have ever had salmon before. So we do a food demonstration and we have a taste testing. So if people taste it and they like it, they're more likely to prepare salmon when they take it. Next slide. We do have a rating system for our inventory. So our agencies, they can look and they can identify those items on our inventory that are most nutritious. Next. These are some recipe cards. It's come a long way from just black type on a white index card. So we know also some of the folks we serve have low literacy rates. So really important for us to have cards, even not just with recipes, but also show some of the steps in preparing that. Next slide. In our nutrition newsletter, we have recipes in there. We typically have some features on exercising, and we make enough copies that can go out to all the households in our network. Next slide. So I want to talk a little about our response to COVID and what we've learned. Next. So as I mentioned, the initial need in the community when we opened our doors in 1980, most of the people unemployed or who were homeless. And obviously with the onset of the pandemic, we saw a dramatic increase. We had already pre-pandemic, the biggest change in who we served is we were serving more households that had someone who was employed but earning low wages. And so the family was struggling to put food on the table every day. And so, of course, then with the pandemic, there was large unemployment, and we saw a huge demand. We had hundreds of people calling us for food assistance, coming to our facility in need of food. And then our Get Help page on our website, that traffic increased by 10 times in terms of people, frankly, in desperate need of food assistance. Next slide. So you see, many of you may have seen the long lines. We had large distributions at the airport, at a racetrack up in Beaver County, here in Duquesne. Next slide. This just shows you a little bit. The drive-up distributions, we had a monthly produce distribution in 18 communities that we did, and we would serve 500 to 600 people in about 2 hours, but people lined up and were in close proximity. So we've had to suspend those produce distributions. And within the first week of the pandemic, we had to come up with a safer way to distribute food, which is how we started the drive-up distributions. Next slide. And we also then have also expanded our network partner. Who's a partner, and we added 150 partners just in the last 2 years. This actually, it's now 150, it was 135, but we added a number of partners that were providing other critical services to veterans, to the immigrant community, Latino Community Center, Casa San Jose, a couple examples. They're getting food boxes from us. They're a whole new category of partner for us. They're not a full-blown pantry, but the people who are coming to them were in need of food. And so those organizations called us and said, we're serving people with providing all these other critical services. We know they now need food. Can you help us? And so we have a great partnership with these community partner organizations, and we're providing them nutritious food boxes. Next. We've also ramped up our community connections, that bold goal, the two ends of the continuum, to reduce the need, shorten the line at our food pantries. We talk about stabilizing people's lives, because when you're food insecure, it's like household chaos, right? You're making trade-offs, not just in terms of food, but rent, utilities. In many ways, you're under-resourced. That's why people are in line. You don't have enough resources to have enough for their families. And so we're doing more to enroll people in SNAP. So they have those food stamps, they have those SNAP benefits, money in their pocket so they can purchase food. The temporary call center, we got hundreds of phone calls a day, is now a permanent call center. We enroll people also in utility assistance and other, some of those basic services. And we have doing a lot to connect with other partners. And so we can refer people if they're looking for a job or interested in a job training program. We can be a connector, connect them to those opportunities. Next slide. We also, through the pandemic, in late March of 2020, on a Sunday, we met with partners to develop a home delivery program, which we've talked about wanting to do for years. By the following Friday, 5 days, we did our first 200 deliveries, and that's a program we're continuing. Next slide. We also really excited in terms of getting food closer to where people are when they need it. Having that 24/7 access to food. This is our first set of 40 refrigerated lockers up in Ambridge. They're refrigerated so they can hold fresh produce, so important to us, but a person can place an order, it'll be put in the locker and they're able to access that at any time. Next slide. So when I look at the opportunities that came out of our response to COVID, the drive-up distribution model has been hugely successful. Our home delivery program, again, something we wanted to do for a number of years. We've really expanded our partner network so that people are having food where they're already going. Again, that getting food closer to where people are. We created that permanent call center. And we have a new focus. We have an innovation team within our food distribution department. Next slide. And we learned a lot of lessons. So really, food banks are traditionally large and clunky organizations, not really quick to adapt, but we've really has forced us as an organization to be much more innovative, to be adapt much more quickly, and that's really helped us. And those are that's staying with us. We're not slowing down. We want to keep that momentum up and continue to look at new and innovative ways to get food closer to people. Next slide. So I look ahead to the future. This kind of just a couple more slides here, then I'll open it up for questions. Next slide. We want to see, what is possible. We want to both that, again, the continuum, we want to meet people's immediate food needs, continue with our core of providing grocery items, but we also want to look at the root causes and provide opportunities for people to have more resources so they no longer need our services. Again, we want to continue to be more agile and responsive and get food when and where people need it. Next slide. So when we look ahead, I think there's great opportunity. We'll expand doorstep delivery. We're talking about some produce hubs that would be open 6-7 days a week. Again, in terms of access, we're in a pilot with Feeding America and Order Ahead that somebody can actually, an individual can place an order. So it's a customized order. I mean, that would turn us into a fulfillment. We could have a fulfillment center. It's just a completely different way to view food banking. We want to continue to grow our network of partners and continue to do that work to connect people with resources. Next slide. So we really do believe at the food bank that food does have the power to transform lives. That's what inspires us every day. We know how critically important having that consistent access to nutritious food is to people. And we're also on a path to have permanent feedback loops and really work together with the people we serve to actually co-create this next generation of solutions. So really excited about the future of the food bank and where we are. Next slide. So thank you so much for your attention. And with that, next slide, we'll open it up for questions.
Yeah, Lisa, thank you very much for giving this presentation. I think for the students, in listening to this presentation and seeing sort of the innovation that the Pittsburgh Food Bank brought to bear during a difficult period or pandemic, there's no wonder why we wanted to partner with them on this challenge. So do we have any questions from the students related to what Lisa just presented? You can either directly ask a question or chat. And I think we do. Alabika?
Yes, I think this was a wonderful presentation, and just to see, the whole process has been it's so inspiring to see how you're working towards this noble cause. But I was just wondering, what did it take, or I'm sure it's like a continuing process, to partner with all the different partners that you have, and what were the challenges that you may have seen as you work through this process?
You know, we're fortunate as a food bank that really it's in our DNA. It's in the makeup of how food banks started, that we started by only getting food out through partners. So it's something that's so central to how we operate anyway. But the challenge has been with adding all these new partners and dramatically increasing our network. It's an excellent question. The challenge has been to keep up with the amount of food that we're getting out to them, but really working through, each organization we work with, they have, different ways that they want the food or where they get it and time of day and what it means to them to get the food. And then the tracking of who are you, where's that food going, who's getting it. So there's a lot that goes into, it's not just a matter of us putting boxes on a truck and sending it there. And it's really understanding, really wanting to deepen our partnership with them. So we may be providing food, let's say to Boys and Girls Clubs, but I had a call with their CEO the other day. It's like, what else can we partner on? What more can we do? To work more closely with you to, have a greater impact on people's lives. Good question. Thank you.
I see we have somebody's hand raised here, Shivanan and Donna.
Yeah, just Shiva's fine.
Sure.
So thanks so much, Lisa, for sharing that presentation. I just had one quick question to better understand your vision. So earlier on in the presentation, you stated that you're trying to get more produce goods out there in your network. And I would have presumed otherwise, because produce goods are by nature perishable. And if you had more non-produce goods, you could get more just calorie content out there for people who are facing the food insecurity. And are you trying to promote healthier food eating habits, or are you trying to just get them the basic caloric requirements for the day? Just to understand that.
A great question. Thank you for that. It is healthier and it's expensive at the grocery store, but it's really a food supply issue. It's really a food sourcing issue. Is those core grocery items are no longer donated. We do buy them, they're on our wholesale, and then our agencies buy them from us, and then it goes out to families at no cost, right? But produce is what's available, it's in abundance. And so we had to look, and actually as Feeding America, and I co-chaired the produce strategy committee for Feeding America a number of years ago to figure out across the country how we could share in this abundance of produce. So it was really, the other food is so scarce in terms of donations that we had to pivot to fresh produce. And it does, it's a radical change. We're renovating our facility right now. We're adding more refrigerated space. We're adding refrigerated docks. We're providing refrigerators to our network. You're right. It's a huge challenge across to get more fresh produce out, which is why we started those 18 produce distributions. Started that in 2006. We started to get more produce in, but we knew our agencies didn't have the capacity to handle it. So it is such an interesting issue and a real challenge in terms of food banking, not just our food bank, across the country. All food banks are focusing much more on produce, but it means our warehouse was built on canned goods and dry and boxed meals. So it's a completely transformational for food banks to handle fresh produce instead.
Gotcha. Thank you so much.
Taylor Robinson, you got a question?
Yes. Hi, I have quite a few questions actually, but My first one was about you talked about the gap in demand for food, and that there's 48 million people who they're still not meeting the need. I was wondering if you have more information on who specifically is in that gap, or there's specific demographic groups, or is this still predominantly like children and elderly people in that gap?
Yeah, great question. There's some good data out from USDA, from some of the census data, but also we have conducted a gap analysis. We're working with a consultant to do that, and we're using the Social Vulnerability Index to really understand the need. It may not say as much about who, but it talks about the level of need, goes down by census tract in our service area. But we do see predominantly, families with children and seniors are at increased risk for food insecurity. So some of that data is out there.
Thank you. I was also wondering too that there's like a new push now for produce. Do you find that when people visit the food bank that they are predominantly taking produce, or is there another need that they specifically want?
That's a great question. That's a great question because, people don't cook as much anymore, right? And so I'm asked that frequently. I mean, fresh fruit, we always have, we kind of have the hard seven, carrots, potatoes, onions, apples, sweet potatoes, items like that last longer, right? We don't get oranges as often as we'd like. People really do like fresh fruit, but we do. And that's why it's been, since we had a nutritionist on our staff in 1991, the first food bank to do that. That's why it's important for us to pair the access to food with nutrition, food education, nutrition education. But people do want fresh produce. They know it is expensive at the grocery store. They're excited. And we focus on having good quality, right? Not just, leaky lettuce or things like that, or, soft melons. So it's really important for us to have the quality of the food for people, but they are interested in that.
Thank you. And my last question.
So we do have a lot of other, so last question, Taylor, because we're.
Absolutely. My last one is that you mentioned the survey. And so I was just wondering how often the survey is distributed, or is it mainly for people who visit the food bank?
Yeah, we don't do, Feeding America used to conduct a survey every 4 years, and they stopped doing that a number of years ago. So the surveys are not conducted on a regular basis at this time. And I will say other items that people want are those items such as shampoo, toilet paper, toothpaste, those items that are expensive at the grocery store. We don't get a lot of them, but those are highly desirable items as well.
So we're gonna push on with some questions until about 11:55, and then we'll, if we go into the breakout time a little bit, that's okay. So I'm gonna ask Rachel. You had your hand up, and for others, if you could type out your questions too in the chat function, that would be helpful. Thank you, Rachel.
Thank you so much for being here. I'm curious, first of all, about how much information you actually know about the people who are coming to your food distributions. Do you know what census block area they live in, for example? And I'm also wondering the breakdown of like what proportion of food are you giving at food distributions like drive-up distributions, and what percentage you're giving through services like delivery services. I know you have some of those, and like I believe you mentioned a partnership with Meals on Wheels. So I'm curious about those two things.
Yeah, so our program department has that break. We do have that by percentage of how the food goes out, where it goes. It's interesting. This is one of the challenges because we work with this pantry network. We are actually rolling out a new CRM called Link to Feed. And it's a more robust database. And we've been rolling that out for the past couple of years. It's been slow. Many of our pantries are run by senior citizens. And so the technology can be a challenge, but because so much of our food goes out through that network, they have the relationship with the individuals and they have that information. So that's one of the challenges we have in terms of data. And that's, I'm looking forward to, getting your all thoughts on that, how we can have better access, I guess, to that data.
Thank you.
Shri, I see you have your hand up, Shri.
Hey all, good morning. Yes, thank you, Lisa, for the wonderful presentation and outlining all the different aspects of the, like how different parts where food insecurity and hunger are faced. So I have a couple of questions. The first one is two things you said in your presentation. One is income eligible senior citizens. So what does it means? Like, does it is something kind of bar on which it is decided that someone will be given food assistance or not?
I'm sorry, your question in terms of a senior citizen?
Yeah, in one of the presentations you said income eligible senior citizens who get food assistance. So like how do you decide like who is eligible for that?
Thank you for that. Yeah, about 26% of the food goes out to seniors. So we have a large senior population here in southwestern Pennsylvania. So for that, that's a federal food assistance program, that senior box program, and it's for seniors who are 60 or older and income eligible, that 150% of poverty line or below. So we work through our pantry network. And again, our pantries know that they each year they ask for income, for people, and obviously seniors are on a fixed income. But we also have reached out beyond our network, and their senior centers, their senior high rises, that in order for us to meet our caseload requirements with the state, we've had to go beyond our network to identify other income eligible seniors.
Okay, thank you. The second question I have, as there are 48 million people who struggle with food insecurity or meeting their ends or making their ends meet. So if I roughly say like 50 million people, and there are food banks not only in Pittsburgh but in every other cities and states also. So what is the joint effort made by the government to tackle this issue altogether? Like, is there any government initiative that helps in making this process smooth without friction, or is there any advancement in any kind of grant which can take care of this altogether?
Well, I wish. It really is a public-private partnership, and we do rely on the federal government, the state government, local government. We have a government affairs team of 2 here at the food bank, and we advocate. One example is the child nutrition is up for reauthorization. That's school breakfast, school lunch, but summer food. So we do really look to the federal government to do more, to expand SNAP outreach, to put more money into their program that provides actual food to us. That's the TFAP program, the Emergency Food Assistance Program. That is good, nutritious food that comes to food banks. We want more of that. We want them to cover some of that transportation costs. It could cost us $5,000 to truck apples from the state of Washington to Pittsburgh. So that's donated apples, but there's a cost to us to get that here. So we're really looking for the federal government, state government, local government to step up, and we do get support. But there's more that can be done if we want to truly eliminate hunger.
Okay, so
the last question, we're going to turn it over to Sakshi at this point, Shri. Last question was Sakshi. So Sakshi, you had a question?
Yeah, Chris, thank you. Thank you, Lisa, for the presentation. I have one question. When we define senior citizens and children, right? Do we have a certain age bar for them when we talk about them, or is it open for everyone?
It is. Well, when we talk about, so children would be under 18, and so when we think about the summer food program, that's any child under the age of 18 is eligible. And when we have our categories of, we serve this percentage of 21% are children, 26% are seniors. I know the federal government for that senior food box program, it's 60 or older. And so that's generally where we say you're a senior citizen. So when we look at who it is we're serving, we do get some demographic information from our net pantry, our network partners. They provide monthly statistics to us, and there is age breakdown, obviously the amount of food that they're getting and distributing as well.
I love all these questions that are coming in. It shows your enthusiasm, and it's exactly the spirit of this discovery period that we're going through. Tree, if you have an additional question, please put it in the chat and we'll look at addressing. I know Ryan had a question about lessons learned through the COVID from other regions. Ryan, that's a great question to bring into the 1 o'clock session with Feeding America, that national umbrella organization that is also responsible for sharing best practices. Lisa, thank you very much for being a part of this kickoff today and answering all the questions. And we have a couple other things that we're going to breeze through related to the challenge. And I'm actually going to turn it over to Monasir, who's going to give everyone a little bit more about the data and the case. But first of all, please, can everyone thank Lisa with me? Thank you, Lisa.
Thank you so much, Chris.
All right, thank you, Chris. So basically, I'll talk about the case a little, how we thought about the flow would go. And we won't go into the details of the summary of the case, for example, but a lot of what we talk about in the case has already been presented by Lisa. A lot of it will be basically supplementing the information that Lisa already provided. So the flow of the case was such that, we tried to kind of introduce you to the concept of food insecurity, giving you the definition of how Feeding America itself defines it. And then we went on to the basic problems that we're facing in terms of, say, the impact from coronavirus, impact on the hunger in terms of children, for example. We gave you a bit of a brief about the Greater Pittsburgh Community Foodbank, the counties that it serves, and also how Pittsburgh is just one of the entire region that they're serving. So when you're thinking about the problem itself, when you're thinking about the case development and your solution, you might want to phrase it in terms of Allegheny County itself, or the 11 county that the Greater Pittsburgh the community bank is serving. So you have to have that in your HIQ development as well. Make sure that you're specifying which region you're focusing on. Next, we talked about the various food insecurity trends in terms of broader nationally, and then we dive deeper down into the service area that the food bank is supporting. We have some information on Allegheny County itself, because Allegheny County is the largest county within this service area. And so we focused a bit on there. And then we moved on to the challenge objectives. As we have already mentioned to you, there are 3 phases here in terms of building out the HIQ, the modeling, and then the last bit, that is the storytelling angle. So a key thing to note here would be that we mentioned this in a word about agility phase, but you have to keep in mind that if you have set a certain problem as your HIQ, and this does not necessarily have to be according to the various prompts that we have given in the challenge objective, you are allowed, and moreover, you're encouraged to come up with your own HIQs. And we are actually giving you more incentives for that in terms of the rubrics. If you just look at the rubrics, there is more incentive for your creativity, how you see the problem, and what you think is the main problem that you can actually look into. You have to think about feasibility when you're thinking about this HIQ problems part, the phase 1. And one very key thing here would be that if you're moving on to phase 2 and you think that, your phase 1, you did not get the kind of feedback you were expecting, or the judges critiqued a certain word, you are free to pivot away from that and then move on to edit your HIQ so that for phase 2, you're tackling a different problem. But what I would suggest is something from my experiences: start looking at the data set itself, so that when you're thinking of it, you're thinking of it holistically, and you're not just thinking about phase 1, but you have phase 2 and 3 in mind before you're going on to before you're tackling just phase 1 itself. So be ready to move away, but again, when you're tackling phase 1, do keep phase 2 and 3s in mind. So we have the rubrics, and then lastly, we go on to the data sources. So let's go to the next slide. Sorry. So we have been gracious enough to have a lot of data coming in here. Firstly, from the Greater Community Pittsburgh Foodbank, where we have their data coming in terms of 3 phases, in terms of people, partner, and product. So in terms of people, you'll get the kind of the people that are being served here. In terms of partners, you're getting some information on this 850 agencies that are supporting the food bank. And in terms of product, you have some amount of information on what is actually being served in terms of mainly, say, poundage, or even in terms of number of meals. So one of the HIQs that we have mentioned in there is poundage actually the right metric? So you might need to look into there, like, when you're looking into products, you're looking into the pounds that are coming in, the pounds that are going out. And you might have to decide there whether actually poundage is the right metrics if you want to go along that line, for example. The digital marketing data is still forthcoming, and we'll give you an update today, hopefully. Giant Eagle has also been very gracious, and they have come up with their own data sets. So they have given us data sets from 3 different stores, one in Hill District, where they're doing free delivery orders. And all these delivery orders are coming in terms of the SNAP credits. And so you get a very good idea of what are these items that people are taking in delivery for in terms of the SNAP eligibility. So you can't just order any item through SNAP, right? So when you're ordering through your SNAP eligible program, like, what are the different kind of items that these people are taking in? Similar sets of data for store 61 and 69. Store 61 does only curbside orders in terms of the SNAP dollars that they're using. And store 69 is a high volume SNAP store with about 70% of their consumers using SNAP payments to buy these products. So again, a high volume of data there, and you can take a look at that to kind of understand, like, what kind of food are these consumers taking in when they have this eligibility for SNAP programs. And we have some other additional data set in terms of USDA, Department of Agriculture. They have their own census tract data. They have 2010, 2015, and 2019 food access research data that you can use to kind of see how the movement has been occurring with time. And we have an abundance of other reports as well in terms of, say, for example, the Food Abundance Index. And we also would nudge you towards doing some kind of maybe geospatial location tagging and trying to find out useful insights in terms of different zip codes, for example. So we have Esri there, whose ArcGIS Living Atlas is very helpful in terms of giving you some spatial location data. And also we have some other food abundance index related maps as well, which gives you maps for the different access areas that they have. So in all these data sources have been updated in the OneDrive link. You should have the access by today, hopefully. The OneDrive link, you will have 3 different folders, one folder entirely for food bank, one folder entirely for Giant Eagle, and then for the additional resources. The additional resources would have the USDA data set and all the other different reports that have actually been culminated together to form this case that we have built out for you.
The word plethora comes to mind. Really a plethora of sources and different information. Thank you, Monastir, and thank you to your team for the case development and also all the work that you had done on the data. I'd like to turn it over to Sandra, and Sandra's just going to talk about some of the service learning opportunities we've identified for you.
Yes, service learning opportunities are a wonderful opportunity to have an impact on the community and learn at the same time. And the Super Analytics Challenge, examining, the issue of food insecurity is there are many opportunities to do so. Now, you probably recall that we had set up some opportunities for you with the Greater Pittsburgh Foodbank in January, but had to cancel those because of the university policy for all remote activities up until this past Wednesday, up until a couple days ago. We are still in conversation with the Pittsburgh Food Bank to reschedule those activities, including opportunities to work at a distribution center and tour the distribution center. So there will be more information shared as we finalize those details. I also wanted to point out that Montessor, I believe Aaron and others have been in conversations with the student executive boards, with the student government, and there's planning underway to do some fundraising activities specifically around the campaign around childhood hunger. So there will actually be more information coming from student government about those types of opportunities. And then last but not least, and this may actually be the most relevant to all of you that are competing in the challenge, is for you to take some initiative and seek out community service learning opportunities that are relevant to your team's high impact question. It is a way to, learn. It's a way to gather data. It's a way to really engage with the community in a sense of it being really relevant to what your team is interested in, and it's a good way to build team spirit as well, and strengthen your relationships as a team to be productive and have fun at the same time. You can find a list of organizations in the Canvas resources module. It's called Organizations Opportunities to Volunteer, pretty straightforward. We put together this list in partnership with Pitt Serves. And if you're not familiar with Pitt Serves, that is the community service organization that's part of the University of Pittsburgh that works with many organizations in the community. So that's what we have for you today. I'm going to challenge you as teams to take the initiative to find opportunities that are really going to be relevant and that your team is passionate about engaging with. And we will also arrange some things for you and share those details soon.
Thank you, Sandra. And I see Andy nodding his head because this is something that our advisory committee members have come up with, and encouraged our teams to pursue, because it helps you internalize the issue of food security and hunger to a higher level than necessarily just digging into the data. You have to do both. And a hint from last year when we did the Super Analytics team, the winning team of last year's Super Analytics Challenge did this. They went out, they spoke to people that had been homeless. They really better understood the issues through that research that they had done. So I want to turn it over. We're almost nearly done with our program. Katie Bennett's going to talk about how we're calling to action through social media awareness for the topic of food security and hunger. Katie?
Thanks, Chris. It would not be a Katz event if I wasn't here to talk to you about marketing, right? Most of my students know that if you don't know me. But we're going to be doing a social media campaign through the hashtag Katz Impact. So we really encourage you to share about this experience through that hashtag campaign. These are the instructions on the screen that will be going out to you later today at the conclusion of the kickoff events. So you will have the sort of accounts that we're asking you to tag, the hashtag itself. There's a special headshot upload if you're interested in getting a profile frame to put on your different social media platforms. And the only other thing I wanted to mention is that if you wanted to get the background that we're using, that was shared in a Canvas announcement yesterday so that you can brand yourself when you're having these meetings. I was also going to invite Aaron Kust to talk about some other initiatives that are going to be happening, but in the interest of time, Aaron has agreed to let me serve as the mouthpiece to let you all know that we have a really exciting opportunity related to some autonomous vehicles that I will be sharing via the Canvas as well. So please keep an eye out on the Canvas and your email because there are more fun things for you to get involved with. And thank you to Aaron for bringing that to our attention so that we can share it with this amazing group of students. So I'm going to pass it back to Chris so that we can get these breakout rooms started.
Excellent. Yeah, and the opportunity that Katie mentions with Aaron Kuss, who's here, is to become a part of an IndyCar autonomous vehicle team with MIT. in which they're in national level competitions to prove who can be the fastest autonomous vehicle on the Indy track. So pretty cool stuff. And we're looking for student volunteers. Yeah, just, we are going to go into the breakouts. We expect you can have 5 minutes of breakouts or, 20 minutes of breakouts. Use it as an opportunity to meet your teammates, and importantly, your executive coaches, if they're here today, and just really encourage all of you to give your best, give your all to the Super Analytics Challenge. Remember that, the ideas that you're generating are for the Pittsburgh Foodbank. We're looking at practical ideas that we can then help further implement through fellowship programs in the spring. That's like the Bridge Program projects. And we also have some grant dollars for fellowships. I'll be announcing more about those. So really these ideas you're generating, we really want to have impact, and we have fellowship dollars for our students to make that impact. So give it your all. Thank you again, Lisa, for being here and attending. Thank you, the executive coaches, and to our students, good luck in this year's challenge. So over to the breakout rooms now.